Now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Hey, welcome to Boomer Life on CL 650. I'm Zach Spencer, and today we are talking about the latest innovations in hearing with NexGen Hearing. And we're going to talk to a specialist here as an expert and what kind of real-world solutions you can have if you're suffering from hearing loss. And Dr. Ted Venema is my guest. He's a registered audiologist. Now, Dr. Ted, you're so enthusiastic. It's a very interesting discussion because, as we've talked about in the past, there's a lot of people who know they have some hearing loss, but there's this whole category of people who deny that they've got hearing loss. So that's a big category, right?
That's a big category. In fact, the market is only about 20% penetrated. Only 1 in 5 people who should or could be wearing hearing aids actually does. And I think it's because hearing loss is an invisible thing. It's an invisible thing.
Well, let's get into a little bit about yourself because you're an interesting guy. You're Dr. Ted, and you are so energetic about your field. So what got you into audiology?
Well, you know what? That's a good question. I was studying speech therapy, speech-language pathology at Western Washington in Bellingham.
Okay, not far away.
No, it's pretty close. And I started studying that, thinking because I'd heard of that field, but I didn't like it. So I switched to the other side, to the hearing side, because all audiology has to study some speech therapy.
So you were studying to help people with their speech.
Yep.
Right. Okay. And then you decided that the core of the problem often is hearing, right?
Yeah. And I just all speech has to learn some hearing, and all hearing has to learn some speech. They call it communication disorders.
Okay.
The department, and I was on the speech side because a lot more people have heard of speech therapy.
Sure.
Than have heard of
especially
audiology.
For young kids.
Yeah.
Right?
Exactly.
Yeah.
And but I liked kids, and I thought I'd like to do that. And but I halfway through it, I went, I don't think so. But that audiology was there, so I just took a lateral shift and went sideways.
And so, what is a doctor of audiology? Like, it's a very high-level degree. It's not. You have to really do a lot of education.
Well, it's
right?
kind of think about optometry. An optometrist usually goes to University of Waterloo in Ontario, and he or she has a bachelor's of science degree. And then goes on for a 4-year doctorate, just like a dentist, that kind of a thing. So in the United States, an audiologist has what they call an AUD, a Doctor of Audiology. And in Canada, it's usually a master's degree. So I got my master's at Western Washington, and then some years later went for my PhD at University of Oklahoma.
Wow. So what was your doctorate on?
Oh, I was doing brainwaves.
Really?
Brainwaves of hearing.
Oh,
so you can tell if someone's hearing by hooking up electrodes to their ears and onto their forehead, and you can read the brain waves. If someone's lying or if someone cannot respond to you, and to let you know voluntarily what he or she is hearing, you can actually measure the brain waves and tell whether they are actually hearing or not.
I was on a flight. Just this past week. There was a little boy there, and he was actually, I heard the mom in front of me talking to the other passenger about the age of their children. 11-year-old daughter, and the little boy was 6. He had the cochlear implants.
Yeah.
And boy, his ability to hear was really high.
Oh, those things have really come into their own in the last decade or two. Like when I was studying audiology at Western in Bellingham, cochlear implants, this is in the late 1980s, they were just emerging.
So can you explain what that is? Because that kind of dives into your brain part that you studied for your PhD and the audiology. And we're kind of getting a little off topic here, but I just find your expertise so unique.
Well, the cochlear implant is not a hearing aid.
No.
It's actually, they burrow like an electrode into your inner ear, which is shaped like a snail. They call it a cochlea. And so these electrodes are snaked up into there. And it used to be that a person wearing, and that's only for someone who's deaf. It's not hard of hearing people don't wear cochlear implants. They wear hearing aids. But this is for someone who's got no nerves left in the inner ear to aid. So you're really trying to bypass that whole thing and send the information straight up to the brain.
So you're going past the eardrum and all of that stuff right into the
into the inner ear. You bet. And so it used to be that cochlear implants kind of sounded like the teacher did on Peanuts. Wah, 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 wah,
Yeah.
wah, wah, wah. That you could kind of, all you'd hear is a raise or fall in the tone of a voice, but you'd have to lip read like crazy.
Yeah.
Now, my gosh, people can talk on a phone,
Hmm.
like without even seeing you. So, there's some star candidates can do that. So cochlear implants have really advanced, and
Well,
they're
this
such
little-
a, yeah.
This little boy, his speech was perfect.
Yep.
And he could, even on an airplane that's loud,
Yes.
hear his mother and his
Yep.
sister talking to him. And,
Yep.
and other than seeing the device
Yeah.
on either side of his head, you would never know
No.
this child
No.
was deaf.
I know. And without the cochlear implant, he would be stone deaf.
So you studied that, a little bit of that? Or?
Audiology studies a little bit of that, and some audiologists specialize in cochlear implants.
Mhm.
But most audiologists specialize in fitting hearing aids for
Right.
the run-of-the-mill adult hearing impaired population. And some audiologists specialize in fitting babies and infants.
Right.
That's different. That's a totally different kettle of fish.
Well, I
too.
could imagine, because they can't respond
No.
to what you're trying to do.
No, and so that's when you take brain waves of the baby to tell what the baby's hearing, and you have to really use a lot of different tools at your disposal to find out what the hearing levels of the baby really are.
So what can somebody like, with your advanced education and your expertise over many decades, bring to NexGen hearing for people who are suffering from hearing loss? What expertise do you dial down to the average person that needs a hearing aid?
Well, I think most audiologists and hearing instrument practitioners, which is like an optician kind of
Yes.
compared to an optometrist.
Or an ophthalmologist?
Yeah. Well, an ophthalmologist would be an ear surgeon or an eye surgeon.
Right,
And
right.
an ear, nose, throat physician is an ear surgeon.
Okay.
So you have the ear, nose, throat, you have the audiologist, which is like the optometrist, and then you have the hearing instrument practitioner, which is like the optician.
Okay.
And the hearing instrument practitioner has a 2-year college diploma, and he or she is equally adept at fitting hearing aids on the adult population as an audiologist. I mean, the audiologist, there's 2 people that the adult can go to get hearing aids, and one's a hearing instrument practitioner and the other's an audiologist. And you know what? In that particular arena, their skills are largely the same.
So how has this arena changed since you started? You talked about in the 80s, and here
Huge.
we are 2016 for hearing aids, because we always think of this big
I
thing
know.
behind the
I
ear.
know, I
Yeah.
know. Yeah, it's a good question, and I'm glad you're asking, Zach. Hearing aids today are all digital. Just like the whole digital revolution that took place, they're not analog anymore. They're not these beige bananas that sit behind your ear,
Yeah.
that whistle and scream. I
Yeah.
mean, those days are long behind us. Hearing aids today are tiny, they're cosmetically just about invisible, and they're digital. And another thing, hearing aids don't just make sounds louder. Hearing aids need a prescription, just like eyeglasses do. You couldn't wear my glasses, I couldn't wear yours. Everybody knows that. But people in the public don't know that about hearing loss and hearing aids. They think, oh, hearing aids just make sounds louder. And
Well, that's the way it used to be,
that's
right?
the way it used to be. And really, everyone's hearing loss is going to be different across bass, middle, and treble tones.
Well,
And
if you
so-
look at everybody knows what an equalizer
Yeah.
looks like. So you have all of those different frequencies. And when you adjust the bass or the mid-range or the treble, you can adjust the sound that you get out of your stereo, right?
Exactly.
So when those are diminished, you
Yep.
can up that level.
Yes.
Is that how it works?
That's exactly. And hearing aids, just like an equalizer, have lots of different channels.
Sure.
And you can, exactly, it's a good analogy. You can just raise or lower the level of amplification, also known as the gain. You can raise or lower that at precise frequencies. Just
Now,
like an
Dr.
equalizer.
Ted, I had a question for you the last time you were on the show, and you were excellent at describing this, because everybody thinks that if you're jacking up the volume,
Uh-huh.
you're going to injure your ear more. And you said that's not the case. Like, if you're turning the volume up,
Mhm.
well, aren't you just going to make the progression of hearing loss quicker?
No, because, well, it's a good question. It's not going to happen because hearing aids have a limiter on them.
Okay.
And they don't allow certain sounds past a certain decibel level, the level that will cause permanent hearing damage.
Okay.
And that's because noise-induced hearing loss is the second most common cause of hearing loss after aging. So
That's the
it's-
one you can't get around.
that's the one you just doesn't. The alternative isn't so hot. Let's
No.
just say that. So no, to answer your question, hearing aids have a limiter on them that way.
So then if we use decibels, then you're like 100 decibels is loud,
Yeah.
right? That's very loud.
Yeah.
So it makes sure that it doesn't go up to
Correct.
a level that's going to damage your hearing
That's
any
right.
farther.
Yeah. Yeah.
Okay, so we talked, you referenced it. One is we're all getting older. That's no fun. You know, when you wake up and you got all those creaks and aches, but your ears are getting older and you don't really notice.
No.
Like you wake up and you got a sore knee or your ankle's sore, you maybe take some ibuprofen and you get
Right.
on through the day. But with your hearing loss, it's progressive.
And it's insidious. It's progressive, and it creeps up on you. And usually the loss is in the high pitches.
Well, what I want to do is I just
Yeah.
want to reference that, because when we come back after the break, we're going to talk about age, and then there's exposure, and the high frequencies is a problem, and also we're going to touch on tinnitus.
Yes, tinnitus or tinnitus, either way. Tomato, tomato.
What is the proper way?
There is no, some say tomato, some say tomato. I say tinnitus.
Okay.
And if it's tinnitus, an itis kind of sounds like an infection.
Yeah.
You know, and tinnitus doesn't hurt. It's just a ringing in your ear.
Right.
And you're the only one that hears it. A doctor can't go listening to your ear and hear the tinnitus.
Can you see it in a waveform in the brain?
Nope.
You can't.
You cannot. Nope. And that's the strangest thing. We'll talk about that.
All right.
Really quite, it's aggravating to people.
And I'm sure there are some people listening to this show that have either lost some hearing capability, or they have a relative, and we're going to touch on that because that's the frustrating part, or a spouse or what have you that is suffering from hearing loss, and the frustration of actually getting them to get tested and fitted for a hearing aid. And tinnitus, we're going to touch on that with Dr. Ted Venema when we continue talking about NexGen hearing, and we're also going to get into some of the solutions for people when we come back right here on BoomerLife on CL650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL650.